Welcome to the Community Health Hero Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Today on Community Health Heroes, we'll be speaking with Mr. Earl Randall, New Orleans Field Office Director for the U.S. Department of Housing and Urban Development, who will talk about HUD's stance on smoking in public housing. Michael Gilliatt, EMS Director at East Jeff General Hospital, who will talk about the importance of heart health and upcoming Heart Month activities. And today on Eat Fit NOLA's cooking segment, we'll be in the kitchen with Ian Benoit of Charcoal's Gourmet Burger Bar. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
The start of a new year tends to bring changes in laws and changes in behaviors as people and communities strive to do better in the new year. With Louisiana ranked 46 out of 50 states for tobacco use and the rate of smoking in Louisiana now higher than the national average, many programs are in place or being developed to help improve the health of our community. Joining us today to discuss a possible ban on smoking in public housing that could go into effect as soon as the early part of this year is Earl Randall, New Orleans Field Office Director for HUD. Thank you for joining us today, Earl.
Oh, thank you for having me.
So you have a pretty big title. I wanted you to tell me a little bit about what you do in Louisiana.
Okay, I'm the Field Office Director for New Orleans, but my jurisdiction covers the entire state of Louisiana for HUD programs. We are a full-service office here in New Orleans. We have multifamily housing, single-family housing, public housing, community planning and development, fair housing, as well as a legal division in the New Orleans Field Office.
And we have public housing all over the state of Louisiana, correct?
Yes, we have
Wow.
public housing all across the state of Louisiana. Louisiana currently has 116 public housing authorities.
Oh my gosh, that's a lot. So I understand that you're talking about a new initiative that you may actually ask people not to smoke in their public housing. Is that correct?
That's correct. The Surgeon General, along with Secretary Castro, announced that a proposed rule for smoke-free public housing.
Wow.
That rule was sent to final comment November 19th, and it's in a 60-day comment period, which would end on January 19th. So we encourage everyone to submit their comments in that would either add or in opposition to the proposed rule.
Either support or be opposed
right.
to it.
Either support or being opposed to it, because it's that open comment period that we invite that public engagement to take part in this process. But as I said, that rule went into the 60-day public comment period on November 19th, and it ends January 19th.
So people don't have much time to respond.
Don't have much time to respond. Actually, before coming, I checked the response, and to date, we've had over 402
Wow.
comments for the proposed rule.
So what are some of these comments? I can imagine it could be anything.
Actually, some of the comments included great support for the
Wow.
initiative. There were some comments in opposition to it, but overwhelmingly there were supportive comments. As you know, about 20% of our public housing authorities across the country had already gone into voluntarily smoke-free policies.
So across the United States, about 20% of our public housing is already smoke-free.
Already smoke-free.
That's
and
wonderful.
that was on a voluntary basis. So with the proposed rule, we're looking to affect about 940,000 additional units of public housing.
How do you think people will feel about not being able to smoke in what they feel is their own home?
Well, I think that's going to be a challenge for some, but some other folk will welcome it. But the unique aspect here in Louisiana, we're not only enacting this smoke-free public housing policy, but my office is partnered with the Louisiana Department of Health and Hospitals, and there's an active partnership with the Tobacco Cessation Program, and so we're providing information to our residents about quitting smoking, the health benefits associated with quitting smoking, and the financial benefits as well.
Absolutely.
So a lot of people don't realize the financial benefits to quitting smoking, particularly for a resident. Let's say you're a one-pack smoker a day. One pack times 30 days, that's a significant amount of money that you've saved by quitting smoking. And a lot of people don't realize a lot of the help to quit smoking, it's absolutely free.
Right, that's a great partnership. They've been on our show.
This partnership, this is one that I've included in our annual action plan 2 years in a row. And so we're actively pushing this. Before there even was a smoke-free proposed rule, we were actually pushing this partnership on the voluntary basis to have our housing authorities across the state to look at smoke-free policies and partnering with the Department of Health and Hospitals to get that message out to residents to allow them to start being physically healthy and financially healthy as well.
So you were talking about health. Tell me some of the health benefits of quitting smoking.
Some of the health benefits, what few people fail to realize is that the public housing population, it affects 700,000 children under the age of 18. It also affects 362,000 elderly individuals over the age of 62. So that population in itself would be victims to secondhand smoke. If you had a smoking unit, if you had smoking units. But the health risk involved in exposure to secondhand smoke, it's the leading cause of respiratory disease and asthma among children. So by having these smoke-free policies, it would help reduce that risk. It would help.
So we'd have healthier children.
Healthier children and a healthier elderly population that can kind of help guide us along the way.
They wouldn't be exposed also to that secondhand smoke.
Exactly. They wouldn't be exposed to that secondhand smoke. But one of the things that I didn't realize was that when we had our initial meetings with the Department of Health and Hospitals, they actually presented the numbers of damage related to smoking. When turning over units, a non-smoking unit compared to a smoking unit, it's a significant higher cost to turn over a smoking unit than a non-smoking unit.
You have to clean it.
Yeah, it's more intense cleaning. It's more, you may have to paint the entire unit, whereas in a non-smoking unit, you won't have smoke damage. The carpets, you may have damage from falling cigarettes, burns, and so all of those costs associated with turning over a unit, it increases the cost of really managing public housing. The CDC did an estimate that in 2014 that the cost associated with having the ban in place would save annually $153 million.
Across the country?
Across the country.
Wow.
That's $94 million in healthcare costs and $16 million in damages due to fire alone, and another $46 million in just renovations, period.
Right, so it's all around saving money, improving health,
Correct.
and help keeping the cost of public housing down.
Correct.
Awesome. It seems like it might be a little tough to enforce. What are your plans to enforce this?
Actually, that's a great question, and when we started to look at it, the infrastructure is already in place for smoke-free policies. So as I mentioned before, some of our public housing agencies had already gone to voluntary smoke-free policies, but the remaining agencies they have an infrastructure in place that will allow them to implement and to enforce the smoke-free policies due to their inspections, their maintenance, their routine maintenance. So they'll actually be able to utilize a lot of their staff that they have currently
That's already
in
there.
place. That's already in place to enforce such a smoke-free policy.
And if we want to know more information about this possible new policy, where would we go for that information?
For more information, and actually, while the comment period is still open, individuals can visit www.regulations.gov and submit their comments. We welcome those comments, and we also have, you can actually mail in comments to the Department of Housing and Urban Development in our Washington, D.C. location, and that's 451 7th Street, Southwest in Washington, D.C. So I know that was a mouthful, but if they wanted to submit an electronic comment, they're more than welcome to at www.regulations.gov.
Great. Thank you so much for joining us today on the show, Earl. When we return, we'll be talking heart health with Michael Gilliatt of East Jefferson General Hospital. So don't go away. We'll be right back with more Community Health Heroes.
When you have a hole in your neck, don't face the shower head.
Suction out your tube before you eat.
Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Welcome back. Did you know that about 610,000 people die of heart disease in the United States every year? That's 1 in every 4 deaths. Joining us today to talk about heart health and the upcoming Heart Month events is American Heart Association Representative Michael Gilliatt, EMS Director at East Jeff General Hospital. Thank you so much for joining us today, Michael.
Good morning.
So American Heart Association's designated February is Heart Month. Can you tell me a little bit about heart disease and how it can be prevented?
Heart disease is a huge thing that affects Americans, and Heart Association has designated February as a Heart Healthy Month. Also, it's a big month for women with the Go Red for Women month. Heart disease affects people of all ages. Heart disease can be prevented by diet, exercise. A number of factors, include regular physician checkups and monitoring your blood pressure, glucose levels, and those, cholesterol levels, those things such as that often lead to a healthier lifestyle, and then, of course, decrease your chance of acquiring heart disease or becoming a victim from heart disease.
And even giving up one thing like smoking or improving your exercise can really improve your health outcome, correct?
Exactly. If you make even very simple modifications, just an exercise program, a diet program, monitoring your cholesterol. Of course, the more you do, the better, but just making simple changes, small steps often lead to dramatic improvements in reducing heart disease.
Great information. So what do you do if you think one of your loved ones is having either a heart attack or stroke? What's the first action?
The first action should always be call 911. Don't ever hesitate to call 911 across the country, our region. 911 is a resource. Call the paramedics. They can come out immediately, evaluate the situation, transport you to the appropriate facility, whether it be a heart attack or a stroke. It's best that 6-7 minutes that you're waiting for the ambulance may seem like an eternity, but the care that you'll receive en route to the hospital, the advanced notification, EMS services now have the ability to transmit 12 leads ahead of time, notify cath lab teams, et cetera, and all those things lead to better outcomes if something is going on, such as a stroke or a heart attack. With women, women don't have the typical substernal crushing, car on my chest, type of chest pain. Sometimes with women it's a jaw pain or a back pain or a shoulder pain, and they may not think that it's cardiac related, but women also suffer from heart disease also just as men do. And women, it's been shown, are more apt not to call 911 as opposed to making the call for somebody else who's in need, because women are not naturally caregivers. But make that call to 911, have emergency services on the way. Also, if someone might be experiencing signs of a stroke, don't hesitate, because with stroke, and heart attack, they're both time-sensitive illnesses. And stroke, making that call getting to a hospital, there are, some treatments that can, reverse the effects that the stroke has taken, on somebody.
And so when the paramedics arrive, what should the patient expect?
When the paramedics arrive, they should expect, an immediate prompt assessment of the situation that is going on, address the emergent situation. It may be acquiring a 12-lead EKG, which we transmit to the hospital. Perhaps if it's a heart attack, it could be something as a aspirin, address the pain, initiate an IV, and appropriate monitor and transport to the hospital, which is important because a lot of people experience a little chest discomfort or pain. They may wait a few hours, and then they get in that car and they drive to the hospital, which is very dangerous because the person driving is nervous or scared, and if something should happen en route, then
You could
They
injure
can't
not just
address
their
it,
life, but somebody
exactly.
else's life, absolutely. And when they get to the hospital, you've already sent the EKG, patient's already on their oxygen, got their baby aspirin and stuff. Does that really improve the throughput time?
it does, because the ER staff is waiting for the patient, the cardiologist often is waiting for the patient, the cath lab team is ready a lot of times, and something that we look at and we track is called door to balloon times, and E to balloon time, which is first EMS contact to balloon time. And heart muscle, every minute that goes by that
It's not with
artery is
oxygen,
blocked
right?
and not providing oxygen, so heart muscle damage could be taking place. So it's very time sensitive. So minutes do matter, and the EMS pre-notification treatment and ability to address any issues that should arise during transport, and then once you get to the hospital, getting the definitive care of the cath lab often leads to better outcomes with patients.
So the quicker you can get your arteries back open, the better your heart will heal.
Yes, ma'am.
Right, so the paramedics can actually hook you up to a heart monitor and send that right to the hospital.
Yes, ma'am. We acquire 12 leads pre-hospital, transmit them. The physician at the hospital is looking at them. Often the cardiologists are waiting for the paramedics to get to the hospital with the patient.
That's great. That's really great to know. So can you tell me about some upcoming events that are going on with Heart Month?
American Heart Association with the Go Red for Women campaign is a very successful campaign. On February 25th, there's a luncheon at the Marriott that and encourage all the ladies to wear red, men to wear red ties. It's a very nice event.
And that money goes towards the local American Heart Association?
Goes to the Heart Association and a number of programs that they do for prevention of heart disease, stroke, and the great things that they do.
And if we wanted to know more about the local events for February, how do we find that out?
At the Heart Association's website, aha.org, and they could look for local Go Red for Women events in their community.
Awesome. Well, I really appreciate you coming to the show today and providing this valuable information.
Thank you.
Coming up next, we'll be in the kitchen with Chef Ian Benoit of Charcoal's Gourmet Burger Bar when they join us for our Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Welcome back. Join us for today's Eat Fit NOLA cooking segment is Ian Benoit and Melina Hayam of Charcoal's Gourmet Burger Bar. Thank you so much for joining us today.
Our pleasure, Dr. Walker.
So tell me what you're going to be making today.
Today, what I'm going to be making is one of our Eat Fit NOLA items. It'll be our crab cake. Special thing about the Eat Fit NOLA one, opposed to our restaurant one, is that we use wheat breadcrumbs instead of a White House, because
Okay.
wheat, of course, is always healthier than anything. So if we're going to get started right now, we're going to go ahead first. That's going to be our crab cake. It's a nice little mix of crab, lump crab, and other herbs and spices. First, what you're going to do is you're going to put the wheat down.
And what's that little ring for?
The little ring is to form the crab cake.
Okay.
So, I mean, you could try and form it with your hands, but sometimes most people don't.
Sticks to you.
It sticks to you, and
Yeah.
most people don't have any luck. So what you're going to do is you're going to press down like that.
And you put the wheat crumbs at the bottom?
Yes, ma'am. We put the wheat crumbs to form the bottom layer of the cake, and then, of course, we top the layer off like that as well.
And do you know about how many calories is in this?
The calories, less than 800.
Okay.
Yes, ma'am. But the good thing about crab, it has that omega-3 acids. It's nice, and it's nice in protein. Also, believe it or not, copper and phosphorus. That's always great for the body as well.
Get some extra minerals
Oh,
there.
yes, ma'am.
And about how many Eat Fit NOLA dishes are on your menu?
Miss Melina?
We've got 7
Okay.
delicious and healthy Eat Fit NOLA items on our menu. We've got the crab cakes, and we have 2 salads, our protein salad and our health nut salad.
Health nut?
Yeah, it's pretty good. It's got some quinoa in it, so it's also got protein. And then we have 4 burgers that are all served on a bed of lettuce instead of on a bun.
Okay.
To cut some carbs. We have our salmon burger, which is low in mercury, if that's something that you're concerned
Yes,
about.
yes.
And then we have our veggie burger, which is like a real New Orleans staple because it's made from red beans and rice. And we also have
Ooh.
a turkey burger and a shrimp burger.
Oh, wow, that sounds fabulous.
Yeah, they're all really good.
All right, I'll go ahead and let you
Well,
keep preparing.
before, a little bit more discussion about that is our prep cooks take a good deal of work, a good deal of time, blood, sweat, well, not blood, of course, that's bad in the kitchen, but no, they spend countless hours preparing our food. They come in 6 hours early every day and
Oh my
start
gosh.
from bare essential ingredients and build from the ground up. For example, our salmon, everything in our store is fresh. Salmon as farm raised. As she said, mercury levels are actually controlled in there. So if you have health issues or if you're pregnant, this salmon is going to be great because it's low in mercury levels, and you can watch your health on that one.
All right,
Yes, ma'am.
I'll go ahead and let you
stop.
keep preparing. Go ahead.
Yes, ma'am. Well, first we're going to have to let this get heated up first.
Okay. So what are you going to be preparing right now? The crab cake?
Yes, ma'am, the crab
right.
cake. And so what we're going to start off is a hot cast iron pot. Then we're going to pour some canola oil in there. Vegetable oil works great if you're doing this at home. So we're going to let that heat up a little bit while waiting.
And so tell me a little bit about charcoals.
Charcoals is almost 3 years old. We're February 14th is going to be our anniversary, Valentine's Day. Charcoals is named after one of the owner's dog, Blaine.
One of the owner's
Preston.
dogs?
Yeah, his dog, Blaine Prestonbeck. It's his hunting dog. It was his companion for years.
Aw.
Sadly enough, he passed away a couple months ago. So
Aw.
our mascot no longer with us. But people come and ask us, charcoals, do y'all cook on charcoal grills? No, we cook on a brisket grill. That way we can get a nice even cook around all the meats on the grill. Yes, ma'am. Also, the other owner, Craig Walker, is also one of the other owners, and him and Blaine also put all this menu stuff items together. And when Eat Fit NOLA came to us, we got with them, and they helped develop the new menu for us as well.
Great. And can you tell that they're Eat Fit NOLA's items? Do they have like a little mark by the page on the rest?
Well, we actually have a whole separate menu for that.
Oh, okay.
So if you'd like to come in and check out the menu, just ask for the NOLA menu, and we'll just hand it over. And you can
Awesome.
check out all the great items.
That's great.
All right. Now that we're actually heated up here, let's move some of this to the side. Here's the tough part, getting the crab cake out.
It looks beautiful.
Bring it over. Make sure everything's nice and flat. And just slide it on in.
Awesome.
Get the extra on top. And we're just gonna let it sit there for about 1.5 minutes while it's cooking.
So where are you guys located?
We're right at the corner of Jackson and Magazine in the Lower Garden District.
And you said you've been open for 3 years?
Yes, ma'am.
And how long have you had the Eat Fit NOLA items?
We've been having it for about 3 months, 3 or 4 months now. Yes, ma'am.
And so people come in and they ask for the Eat Fit NOLA menu?
All the time.
All the time?
All the
The word's
time.
gotten out?
Getting
Yes,
really
ma'am.
good feedback on it.
Awesome, well, because these dishes look incredible.
Oh,
And we have a little popping going on over here.
that's always a good thing. And we'll move it around a little bit, make sure it gets a nice little clean cook on the bottom. When it gets turned around, it's going to have a nice little sear to the bottom of it.
And so are you open for both lunch and dinner?
Oh, yes, ma'am. But also, we are also open for breakfast now.
Wow.
Yes, ma'am. 7 to 11. None of the Eat Fit NOLA menu items are in there, but
Yeah.
it's a good checkout. It's nice and hearty. You know, there is some healthy items. You actually build your own omelet from the ground up.
Oh, wow.
Oh, yes, ma'am.
Get egg whites
ma'am.
instead of regular eggs.
So you're open for breakfast, lunch, and dinner?
Yes, ma'am.
And what are hours of operation?
Hours of operation, of course, is going to be 7 to 10 o'clock at night.
Wow, that's
Yes,
pretty
ma'am.
long. You guys barely getting sleep.
Oh, she does, not me. All right, so here we go. Then we're going to flip it. There we go.
Beautiful. And this is served on a bed of lettuce?
Yes, ma'am. Well, no, ma'am, not this item. This item is actually going to be served on a white plate, and it's also going to have a nice little covering of corn machu to finish that off. So at this point, what we're going to do is we're going to toss this down in the oven.
Okay. So you pan fry it for just a few minutes and then you're going to put it in the oven?
Yes, ma'am,
Okay.
exactly.
Awesome.
Put this down right here. And then after, the finished product is actually going to come out looking like this.
Oh, that's
Let me
beautiful.
get this out of the way. All right. Let me get the next pan out.
Now, did you have to make were these items on your menu before and you had to make changes, or were they brand new items that you put on your menu?
All the items are actually on the menu before, but when Eat Fit NOLA came in, they decided we're going to try and go for a healthier twist to it. So as you can see with the patties, this is just usually served on sweet buns, wheat buns in the store, but we went with a lettuce wrap on this one so we can keep it nice and healthy. But the salads are also on the menu as well, but there's another twist to it. We took out some of the unhealthy aspects to it and kept in the healthy ones.
The salads that we changed though, they're still really delicious on the Eat Fit NOLA menu and super hearty and very filling.
Awesome.
All right, so the next aspect of it, we're going to be cooking the machu, heating it up. With the Fit NOLA, we don't put as much machu as we do with the regular crab cake order that we have on the menu.
So a little bit less machu.
Yes, ma'am.
But you didn't have to change the recipe a lot?
No, ma'am, not at all. So
Looks delicious.
you can already start to smell it as it's heating up. Roasted red peppers, all that great stuff. We'll turn that off.
And do you have a website?
Yes, ma'am. It's going to be charcoalsgourmetburgerbar.com. And there we go. Just do a nice little line like that.
That is beautiful.
That's the NOLA Eat Fit crab cake.
Well, thank you both so much for being on the show today and sharing these incredible and beautiful dishes with us that are also healthy.
Yes, I appreciate it. It's been our pleasure. Thank you.
And we'll be right back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find us on YouTube. We hope that the information we provide today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.